This MediSync ECG review will focus on case number 436 from ECG Wave-Maven. Copyright information is provided here. This ECG is from a 78-year-old woman in critical condition. It shows all of the following except frequent atrial premature beats. This ECG shows sinus tachycardia with a P-wave rate of about 100 beats per minute with a Mobitz type 1 AV block, 3:2 as well as 2:1, in the context of an acute ST elevation inferior and possibly posterolateral myocardial infarction. The effective ventricular pulse rate is about 66 beats per minute. The AV Wonky-Bach periodicity simulates atrial premature beats. Note the reciprocal ST segment depressions in leads 1, AVL, V2, and in V3, with a relatively tall R wave in V2, the latter consistent with the posterolateral involvement, as well as incipient Q waves inferiorly. ST depressions in V4 to V6 also raise strong consideration of lateral involvement. There's borderline low limb lead QRS voltage, and the ST segment elevation is greater in lead 3 than in lead 2, with ST depressions in lead 1, which is consistent with total occlusion of a dominant right coronary artery supplying the posterior descending artery, confirmed at angiography, as opposed to a dominant left circumflex occlusion. This large infarct was complicated by an acquired VSD due to the extensive myocardial necrosis.